Um, so tonight is actually going to be about my first day in the mental health unit. So this one was pretty traumatic in so many different ways. So at the time, I didn't realize the were options could be possible, low level options besides therapy. But that's not what was traumatic. I was just saying, like, try the other levels below mental health unit if you can first. So it was September 9th of 2021. I was in a really bad spot. And luckily, I had a therapy appointment with my therapist at the time. And we had already scheduled an appointment for that day. And I messaged another friend of mine on Facebook about how I was doing, how frustrated I was. So this was obviously in the middle of the pandemic, and everybody was still wearing masks, and so I said, and I did. I had a plan to overdose on pills on September 11th of 2021. So I went into the appointment knowing what my therapist meant by we have something we need to talk about. A lot of things led up to that stay. So unemployment was running out here in Maryland, and I was not eligible for unemployment after the pandemic unemployment system was done, which made no sense to me because unemployment is supposedly for those that are unemployed, but it's more like for those that are underemployed. So that was frustrating. I had no job. I had no income. I was on it, irritable a lot. I was feeling really down, like it wasn't worth it anymore. So I also had gotten into an argument with a family member, and they said some stuff that really put me, that made me feel even more over the edge and even more of a burden. And so what happened was we talked about, like, during the therapy appointment, we talked about how I was feeling, what my plan was, if I had intent, if I had a date. And then the therapy time was up. But the therapist was going to look up different things in this area, in my area, since she lives in North Carolina. And for like adults with disabilities. And she was very upset because there's not much here where I live in Maryland for people over the age of 21 that have disabilities. So we both agreed that she would call the local crisis team for me. And then we got off, and she called, and then she called me back and said that they'd be here anytime that night, that evening. So I was up here in my room, really anxious, waiting for the mobile crisis team to get to my house. And they did come. But there were also 2 cops with them. And the cops were just watching me. We talked, and then to see if that was a good thing, a good fit for me to go to the hospital at that time. And we agreed that it was the best thing for me to do. So I went into the hospital ER, the regular ER, in an ambulance. And that way I didn't have to be handcuffed, and because that's policy, even for mental health problems, that if cops take you to the hospital, that they handcuff you. So, but the cops weren't looking out at our neighbors, looking out to see what was going on. Like, they were all out of their houses, and that made me feel very unsafe and traumatized. We ended up having 1 or 2 police cars, the mobile crisis unit car, an ambulance, and a fire truck, all before I was taken to the hospital at our house. So then in the regular ER, they talked to me more, took my vitals, then took me to this holding area for people waiting to see if they're going to be admitted to the mental health units at the hospital, and which mental health unit they're being admitted to, if they're being admitted. So I don't remember if it was at this one or my second one, but one of the 2 times that I was hospitalized at this particular hospital, somebody was crying next to me, and then I started crying because I really didn't want to be there, but I knew if I didn't go voluntarily, there would be I'd be there for at least 3 days involuntarily. Involuntarily. So those are the two ways you can be admitted to a mental health unit, either voluntarily or involuntarily. So I agree to go. I waited the whole night in that holding area for the mental health units. I talked to some evaluator. I don't know if it must have been a social worker or something. I'm not quite sure what his job title was. And he said, "What brought you here?" And I started talking, and he interrupted several times, saying, "I don't want to traumatize you," but I was trying to explain to him why I was there. So that didn't sit well with me. Then at 3 a.m. on the 10th, I was admitted to a mental health unit for the first time. So they gave me all of the things that I told you about last night, which was the patient rights, the rules on the unit, the schedule. They handed me a bunch of stuff. And they gave me a composition book to write in for when I was there. So at that time, I had not been on any medications for mental health. So that was the first time I was put on a medication for my mental health during this stay. But this became very traumatizing to me because I had that night because we got up at 7 a.m. every day. And I think lights out was at like 10. And so I called a couple of family members to talk to them. I called my pastor to talk to him. I called my therapist to talk to her. So during the time there, it was my very first full day there was September 10th. And I ended up having a 10-minute long breakthrough seizure. All I knew was going to the nurse's station before having the seizure. And them telling me to sit down and wait for them in one of the chairs in the day room where we all meet during the day and for groups and all that. So I sat down, and I guess that's when I started going into the seizure shortly after. But I had no clue what was going on around me. Obviously, during a seizure, that happens most of the time. Especially for me, where I'm like so out of it that I don't know, hear anything or see anything until I'm starting to come out of the seizure or I'm out of it. totally out of the seizure. So I was taken to the ER. Let me back up. So during the seizure, as I was coming out, I was hearing them call cold blue and then the unit name. And I was like, who are they calling a cold blue on? Like, and then I opened my eyes and all of the staff on the unit, like nursing staff on the unit and paramedics were surrounding me. So back to the ER I went. Then they discharged me back to the mental health unit. Then 2 days later, I had a second breakthrough seizure. And I went back to the ER again. This time it was just by wheelchair, which I didn't understand why I needed an ambulance just the first time because it's the same hospital. It's just like a couple minutes away from the main hospital. So I didn't understand that, the need for the ambulance ride the first time. But again, it was another 10-minute long seizure. And this time I was admitted to the medical side of the hospital. There, my dad asked where my things were that they had locked up, and they had no idea. The mental health unit had no idea. So we had to call the patient advocate to help figure this stuff out and figure out what was going on, where my stuff was. I was in the mental health unit from the 9th through the 12th. And then I was in the medical part of the hospital from the 12th through the 16th. Because I was supposed to go back to the mental health unit on the 15th. But like I said in a previous video, I woke up that day confused and not able to answer the awareness questions of where I was or who I was or what date like it was or any of that. So my neurologist at the time said, let's keep you overnight one extra night before we discharge you. So because one of the meds that I was on while on the medical side of the hospital for the seizures could cause confusion. So she was totally honest with me. She's like, we will have to keep you an extra night just to keep an eye on you. And I appreciated that, but I was also frustrated because I did not want to be put back on seizure meds. So that was more meds to deal with when I got back to the unit on September 16th. And then I was discharged on September 20th from the unit. So I was only on the unit the first time around on the weekends. And they don't have a psychiatrist. They don't have much staff on the weekend. There were social workers. The psychiatrist might have come around, but I don't remember if he did on the weekend or not. But I was only there on the weekend, and then that on the 20th. So the only weekdays that I was there really was Friday, September 10th, and then the day I was discharged on the 20th was a weekday. So I didn't really get much help when I was there the first time. And this being discharged on the 20th with like no help formulating a safety plan, no like follow up at all after I was discharged by the staff, um, to see how I was adjusting to life, being back out in the real world, because it does feel like, well, jail, because you're locked up for all day long. This unit, you were allowed to, like, there was a part off of the unit that was closed in by a fence that we could be out in. But when I got back to the unit, they welcomed me. The staff was nice and welcomed me back, but there was this one really rude staff member that told me whenever I got up to walk around the unit after that second breakthrough seizure, that to sit down. And I was like, I didn't say anything, but I was thinking, you think I want to sit down the whole day? So that was not very nice either. When I was on the medical side of the hospital, there was one nurse that said, like, I was in a room where there was a nurse in there 24/7. And he's like, are you trying to escape your bed? It was, and that was very rude and very mean, not very professional, in my opinion. So, did I make friends? Yes. Did I keep their phone numbers and stuff? No, because at that time I did not think of it because I wasn't there during the week, so I didn't have much time to ask for phone numbers of my friends. So I don't know any of their phone numbers, and I don't keep in touch with any of them anymore. Tomorrow I would talk about my second hospitalization and how that was a little similar, but also a little different from this first time. I will see you tomorrow. Thanks, and bye.